Hi, I wanted to thank you for taking a few moments to look at this video and understand how Medicare works. The goal of this is to understand how Medicare works, what your options are, and how you can choose. Medicare Part A is premium free because of the taxes that you paid during your working time or your spouse's working time. It covers four things. It covers hospitalization, inpatient hospitalization, home health care, skilled nursing, and hospice care. Okay, and they all have different out-of-pocket cost sharing, and we're not going to go over that now, but if you're interested in knowing the details, I'd be happy to tell you more about it. I'll actually include a link with the costs. And Medicare Part B has a premium that you pay every month if you're collecting Social Security. It comes right out of your check. And that premium is based on what your income was 2 years ago, believe it or not. Otherwise, you'll pay the base premium, which hasn't actually been set for 2020 yet, but for 2019, the base premium was $135.50. And again, that depends on what you earned 2 years ago on your income taxes. But Medicare Part B covers outpatient type services like emergency room, doctor visits, lab work, durable medical equipment, physical therapy, those types of things. It is much more simple to understand as far as you pay a premium, you have an annual deductible, and once your deductible is met, Medicare pays 80% and you pay 20%. Of course, there are a lot of out-of-pocket costs and your exposure is not limited, which is why people pick other types of insurance to help offset that. And it also doesn't cover, obviously, prescription drugs and dental, vision, chiropractic care, and that sort of stuff. So Medicare Part C, that's Medicare Advantage, and it is optional. That actually combines original Medicare A and B, and most of the time Part D. It pays instead of original Medicare to your providers, so your Medicare is no longer your primary insurer. You still have to keep Medicare to get Medicare Advantage, but it just works much differently. I consider it like, I guess, diametrically opposed or the opposite end of the spectrum from having original Medicare and perhaps a supplement. Medicare Part D is your prescription drugs. And by the way, if you enroll in C or D or both or whatever, Medicare actually pays the company that you're enrolled with a fee every month for you to be enrolled in the plan. So that's basically like a subsidy that they get that help offset the costs. Okay. Now, we're going to go over the difference between a Medicare supplement and a Medicare Advantage plan. With a Medicare supplement, you can go to any provider in the country that takes Medicare. With an Advantage plan, you can only go to providers that will accept the plan or are contracted with the plan. So that's a huge difference. I think, again, based on what you value, to me, that there's no price tag that can really replace that. Changes with a Medicare supplement, the premium does go up every year, but the plan never changes. The plan that you buy stays the same and pays the same for as long as you continue to pay the premium. Medicare Advantage, however, are yearly contracts that do change every year, so that's why there's an enrollment window of October to December every year to make sure that the plan changes, if it's still around, is going to fit for you. Medicare supplements, you actually can enroll anytime, but you may not be able to be accepted if your health is poor, or you have a health issue, or you can't afford the premium. Obviously, that would prohibit you from buying it. But with Medicare Advantage, you commit to keeping the plan for the duration of the year, with the exception of some special circumstances. You can change every year from October to December, and you're also able to make a change to a different Medicare Advantage plan in some instances the first 3 months of the year. So that's how that works. Access to care, again, if your doctor says that you need a surgery and it's medically necessary and something that Medicare would cover, then your Medicare supplement covers it without question. With a Medicare Advantage plan, you do have to get an approval from the plan and follow the rules in order to get your care. You could look at a Medicare supplement as a pay now because it can cost more upfront, but it actually saves later depending on how much you use it. And Medicare Advantage is often like lower cost, like there's a lot of zero premium Medicare Advantage plans, and I call that save now, pay later, because you could have to pay as much as the maximum out of pocket, which can be better than just original Medicare, but you could to potentially, like, suppose the premium for the supplement is $100 a month, that's $1,200 a year, and this premium is zero. Obviously, zero is less than $1,200, but suppose everything went wrong under your Medicare Advantage plan and you had to pay all the copays and your maximum out of pocket was, say, $5,000. Obviously, the supplement, with the same care is less because you only spent $1,200, depending again on which letter you get. We'll talk about that in a minute. You have to get separate coverage for prescription drugs with a Medicare supplement because it's not included, but with an Advantage plan it usually is included. Okay, so all Medicare supplement plans are standardized, okay, and these are being antiquated, so they won't be available for people to start January of 2020. But the best value is really the Plan G. That covers almost everything but the Medicare Part B deductible. But of course there's other options, and so that's why I said that it depends. Oops, that's not what I want. There we go. Choosing a company. So with Medicare supplements, I think I mentioned that there's about 47 insurers that write business for Medicare supplements in the state of Tennessee. Because Medicare supplements are standardized, so it doesn't matter what company you get it from, whatever, let's say you get a Plan G, it's going to work the same no matter which company you go with. The first thing that differentiates them is price, so that's something to consider when you're picking a plan. Also, customer service, financial solvency, like how trusted is this company and their financial stability, market share. So the more lives they insure, in theory, the more they are able to spread their risk and, in theory, be more stable. And then you would hope that historical rate increases would be indicative of what they might do in the future, but it actually isn't, but it does kind of give you a little indication of something. It's just sometimes it's hard to get that data because they make rate increases based on their book of business, which is difficult to get that information, and based on age. So there's two factors that go into that. And Medicare supplements, by the way, are regulated by the state, so they have to file a rate increase with the state and get that approved. Medicare Advantage, when you're considering companies, you want to look at your out-of-pocket costs because the benefits designs are so differently. You want to look at extra benefits perhaps, but most importantly, actually, second to your out-of-pocket costs, really are going to be the network. Are your doctors in the plan? I mean, what good is it to have a great plan with all these frou-frou benefits if your doctor doesn't take it? Obviously, that doesn't make a whole lot of sense. So, Medicare Advantage plans often can have prior approvals and rules to obtain services, and so they could vary among plan. That could be a factor in deciding. Customer service, very important. Again, if your insurance isn't very helpful when you need it, that really puts you in a pickle. So it's really great to have helpful customer service. Medicare also rates these Advantage plans on 50 different items called a star rating, and those ratings are published on the Medicare site and in your Medicare book. And you can't hang your hat on the rating, but it is something worth looking at. 5 is excellent. 3 is good, 2 has a warning, and 1 2 and 1 are low performing plans. And things that they consider are how agents behave, complaints, customer service, how well the members participate in the plan, how well their health outcomes are managed, and that sort of thing. And then also you can kind of look at the stability of a plan. I think it's a little raise an eyebrow when a plan looks amazing this year, but what was it like last year, So I think that's worth looking at. How do you decide between a Medicare supplement and a Medicare Advantage plan? Do you prefer a Cadillac or a Camry when it comes to driving a car? I know that's silly, but I think that says a lot about who you are as a person. Another thing you want to think about is flexibility the most important to you. How important is it to have access to care? Is it is that really is your maybe your budget and upfront low cost the most important thing to you? I mean, then that really dictates your options right there. Um, if you're all about the perks, which I would never make my health care decisions based on, but it's not about me. If it's all about the perks, obviously that's important. Um, and I just encourage you to think about how you make your buying decisions and if you want to limit your risk. Let's talk a little bit about how Medicare Part D works, because everybody has to get a Medicare Part D plan, even if you're getting it separately or built into a Medicare Advantage plan. All Medicare Part D plans work on Medicare's basic coverage design, and they have to cover at least 2 drugs in each drug class. So you're never going to be prescribed a condition for which there's not any drug on the list of covered drugs to treat it with. It just may not be the one that your doctor prefers. But you can ask for formulary exceptions to be made. Just know that if it's approved by the insurance company, you will have to pay the highest copay. So, all of them have a list of medications that are covered by the plan or a formulary, but those vary from plan to plan. And in fact, that's one of the ways that I help people determine which plan is going to be right for them by looking at their particular drugs in the pharmacy they use and seeing which plan is going to help them the most and give them the lowest out-of-pocket cost for the year, because your drug costs are going to be different based on the drug you're taking / the manufacturer, your insurance, and the pharmacy that you go to. All Medicare Part D plans make you use network pharmacies with the exception of an emergency, and they all have a tier structure for copays, so the lower the tier, the lower the copay. Oh, I forgot to say that they all have coverage rules to follow, and coverage rules could apply differently to different drugs on different plans. Some may not have a coverage rule, but those are things like step therapy, meaning, yes, we'll cover this drug, but before we cover the more expensive drug, we want you to try a lower cost drug too. There's also quantity limit, like we'll only pay for so many drugs over a certain period. And prior authorization, which means, yes, we cover it, but we want the doctor to show why it's indicated in your case. All of these rules can be waived. Again, I can help you with that, or your doctor can work directly with the plan to get that taken care of, or your pharmacy. So if your plan has a deductible, then you pay everything during the cost of the drugs. This is a little misleading. So the donut hole has closed for 2020. However, you'd think since you're paying 25% during the initial coverage phase and through the coverage gap that your costs would be the same, especially since it's even here, but that's not the case. It really depends on your drug mix. And then if you ever have to reach the catastrophic phase, you would only pay 5% of the cost of the drugs, and that's triggered when you've spent $6,350 out of pocket for your prescription drugs. I think I told you that there are differences amongst the drug plans. There's 30 options available in most areas, but the plans are very different because there's not any that cover 2 drugs the same way as far as the cost and things, and one plan may cover a drug and another plan may not, so that's why it's very tailored to your specific situation. Some have a different number of medications covered, some have different preferred pharmacies. How do you pick a Part D plan? Look at your costs of your particular prescriptions. And I told you about how they vary, and even though the coverage gap is closed for 2020, you still have to pay 25% of the cost of the plan's negotiated price for the drug. And some people's medication costs go up and some go down depending on the medication during the donut hole, so I can show you that in your particular situation. Here's an example. This person, I just made this up, are on these particular medications. Before the deductible they had to pay this much. After the deductible they pay this much. During the coverage gap they pay that much, and they reach the coverage gap in February and they come out of the gap in April. And then after, when they're in the catastrophic phase, their costs go down. So thank you so much. I look forward to working with you. Let me know if you have any questions.